Tony has been an MP now since 1990 and represents the Bay of Plenty electorate, but most of us will know him as the current Minister of Health, and he is retiring from politics to have a life after this election, and we really appreciate him, and we appreciate his wife allowing him to come here on a Sunday morning. Thank you very much.
Well, kia ora, good morning. Thank you very much for the opportunity to say a few comments here at your annual event. Yes, I am leaving. I read in the paper last week that upon his retirement, President Clinton was giving speeches for $1 million a pop. So I think you should consider this as a heavily discounted opportunity, and wonderful to be here. That's right. My wife also said to me, how many people do you expect to be here? I said, they thought about 100. She said, well, that will be the biggest non-theological meeting in Wellington on a Sunday morning. So it's really good to be here. Can I start by acknowledging Graham, the CEO of the Foundation, Dr. Anthony Lowe, Dr. David Sando, and also Professor John Nacy. Thank you very much, and it was interesting to hear you today too. So everyone here today understands the impact of prostate cancer on New Zealand men, and as you know, it's the most commonly registered cancer, and it is by far the most common cancer for men. And I think most New Zealanders are stunned when you talk about 3,000 men diagnosed with prostate cancer every year, and 600 dying from it. You know, every one of us, particularly in this room, will know someone with prostate cancer. Former British Prime Minister Sir John Major spoke of the heartbreak of watching his brother shrink and fade and finally die from prostate cancer. It's also well known that the former Australian Treasurer and Deputy Prime Minister Wayne Swan had prostate cancer at the age of 48. And you may have heard the story that he often tells of how he convinced a mate to go and get tested. And this involved, as you know, a DRE. And so his mate was sitting there apparently getting increasingly concerned as the doctor started snapping on the rubber glove. But when he saw the doctor starting to put on a second rubber glove, he began trembling with fear. And this bloke apparently mustered up the courage to ask what was going on. You know, why have you got gloves on both hands, he asked. And the doctor said, it's just in case you wanted a second opinion. That's a true story, apparently. So, so for years there's been local and international debate about how best to approach the management of this disease, and it's certainly a challenge that we as public policy makers have faced with this divergence of argument and opinion about this. Are we testing too much or too little? Are men better off or worse off as a result? And do the effects of treatment outweigh the benefits? Is the PSA test a help or a hindrance? And these are the sorts of things that politicians are not really that well equipped to answer. As the distinguished urologist Willett Whitmore said, the quandary in prostate cancer is this: is the cure necessary in those for whom it is possible, and is the cure possible in those for whom it is necessary? So as you know, in 2011, the Parliament's Health Select Committee conducted an inquiry into prostate cancer so it could better understand the issues facing men and provide more bipartisan advice to policymakers about where to. It received submissions and expert advice and reviewed current evidence on prostate cancer testing and treatments. And after quite a lengthy period and a lot of advice and evidence coming from many people in this room, the committee recommended against establishing an organised national population screening program for prostate cancer. And it concluded that while PSA testing saves some lives, it must be balanced against the known side effects of further investigation and treatment. And the committee acknowledged the need for a better, more cancer-specific and sensitive test for prostate cancer and encouraged men to seek advice from their GP. And the committee made 17 recommendations that were supported by Parliament, including the Ministry of Health, establishing a prostate cancer quality improvement program. And Professor Nacy and Mark von Dadelson, and perhaps others here today, are directly involved in supporting the Ministry of Health and the government to deliver a range of initiatives that will improve outcomes for men with prostate cancer. And it really is a government priority. In last year's budget, the government committed over $4 million over 4 years to raise awareness of prostate cancer and improve the care that New Zealand men received. And this is in addition to $33 million over 4 years, which we've earmarked for what we call our Faster Cancer Treatment Program, so that better and faster cancer services can be provided for all New Zealanders, no matter where they live. And the government will be making some further announcements on this in the next month. And this year the government announced new initiatives as part of Budget 2014 to make sure that the emotional needs of cancer patients and their families were being properly assessed. If we recall, a couple of budgets ago we funded quite a lot of extra money, I think about 16 million, to establish cancer care coordination nurses across all the cancer centres and DHBs in order to provide a point of contact and reference and to smooth the treatment path for patients. But one of the very clear messages that's come out of all the groups that support us in these ways, Cancer Control New Zealand, other consumer groups, has been the need to provide greater psychosocial support for cancer sufferers and their families. And that's why in this year's budget we've set aside a significant amount of money, which is going to see additional psychologists at the 6 cancer centres and 20 psychosocial or cancer support workers established across the country. So there's also a comprehensive program of work underway that's going to give men better access to quality information and care. And I was pleased to be able to join Professor Nacy at the launch of that just down the road here last year. This is designed to provide better guidance for GPs around who to test for prostate cancer, who not to test, and who to refer to a specialist. There's been some sort of misnomer that we're actually being highly directive in this program. It was really about just giving GPs the information and resources to be able to have a conversation with their patients. A range of consumer resources have already been released that will help men, and there's more to come. Now work has started on a tool to help men and their GPs have more informed discussions about prostate cancer and make better decisions about investigations and management. And this year, clinical standards and guidelines will be developed, and there will be enhancements to patient management systems, that's the computers that GPs have, to help GPs manage men with prostate cancer. Alongside this work is the development of a guidance for GPs and specialists about the use of active surveillance, which is a relatively new treatment option for men, and you heard all about that. And it will be most interesting to see how that goes. Work is already underway to develop a reporting framework, as you've heard, for pathologists to use that will standardise the way a pathologist's assessment of a prostate biopsy is recorded, and it will help to improve the accuracy of diagnosis and the staging of prostate cancer across the country. Gosh, there's a lot going on. A monitoring and evaluation framework will measure the impact of the new supports, resources and systems development, and will align with other existing data collection points such as the Cancer Health Target and the Cancer Registry. And this work is happening alongside a myriad of other initiatives to improve cancer care in New Zealand, including prostate cancer. Government's very keen to speed up the whole cancer journey for New Zealand patients, and so we're implementing a new faster cancer treatment time target, which is setting new benchmarks about how long patients should expect to wait to see a specialist once their GP refers them, how long it should take from that point to get a diagnosis, and how long from that point until they begin their first treatment. Currently, about 60% of New Zealand patients who present with their GP with a high suspicion of cancer will begin their treatment within 62 days. That's 60%, and the government's objective over the next 3 years is to lift that to 90%. This will be a huge ask for the whole of cancer services, as it means we're going to have to speed up people's access to specialists. We're going to have to dramatically improve the diagnostic tests and pathways and make sure that we can meet everyone's expectations of getting their surgery, radiation and chemotherapy much faster than they are now, although those later bits are already at world gold standards. So it's going to be an amazing piece of work that's going to happen over the next 3 years. And the great thing about being a retiring Minister of Health is you get to set all these objectives for the next guy and not be responsible for them. Anyway, I'd like to thank you for all the work that you're doing supporting men and their families who have been diagnosed with prostate cancer. In my role as Minister of Health, I've overseen quite significant changes and improvements in services, and I've been ably supported by a fantastic group of people across the health system. We've really transformed our services with a great effort by just about everybody, but there's still a lot more to do. So as I said earlier on, I'm leaving politics at the election. It's been a great pleasure to be able to work with such high quality people throughout the health system who have real dedication and a commitment to improving the lives of others. I wake up most mornings and I turn to my wife and I say, imagine being Minister of Education. That is a really tough job. So thanks very much, and I wish you all the best for what looks like a fantastic Sunday event here in Wellington. Thank you.
Minister is happy to take questions.
I can take questions on anything other than the ETS.
Or education.
Oh, yes, that's right.
This isn't really a question.
I can answer
I'd
this.
like, on behalf of the grassroots, and I represent a small part of the grassroots of the support systems, I'd like to thank the government for what they've actually done, because there is a sense of catch-up going on. We've sort of been running on the spot, and suddenly the treadmills become a footpath, and we're moving forward. And I'd like to thank you and your ministry, the people that are working in the background, but we hardly ever hear about them because they're working damn hard. And same with the people that are working in the DHBs, in the PHOs, all of those systems who are really helping the journey. Not for me, because I'm an old man and I'm going to leave the planet soon. And I know some people think I'm from another one. And maybe that's a conspiracy theory. However, I'd like to thank, through you, to thank those people on our behalf, because without their work, without their enthusiasm, without their set of values, we'd be still staggering and figuring, why is this bloody treadmill going and why are we getting thrown off it? Thank you.
Great, no, thank you very much. I'll pass
Thank
that
you,
on to them.
Yes, madam.
I was interested that you commented about New Zealand being the gold standard. To what extent are we on the world platform of prostate cancer care leading the way?
Look, I couldn't give you an answer on whether or not we're leading the way on prostate cancer care from an outcomes basis. I think we are leading the world in the sense that the work that we've done around the Prostate Cancer Task Force and the working group has developed a consensus about pathways and treatments and discussions that surprisingly doesn't seem to exist in a lot of health services around the rest of the world. As I travel around, and I don't do a lot of travelling, I might observe, but keeping your just reading, and I don't take a lot of taxi trips either if you read lots of paper. It's great to see the media focusing on what really matters in health, isn't it? 20 taxi trips a week. As I travel around and talking to other health ministers, it's quite clear that prostate cancer is not on the radar in a lot of health services around the world. And similarly, there's not a lot of consensus about how the system should move forward in this area. There still seems to be a lot of argument about what the treatment should be, whether or not it's something that people should be focused on. I think here in New Zealand, with this huge work that's gone over on the last couple of years, we're actually at the forefront in terms of having a consensus about the path to go forward. When I talk about that we're at the world gold standard, it's particularly around our national health target, which we're going to replace in cancer, which is that those people who, once they're ready for treatment, should get their chemo or their radiation within 4 weeks. If you recall, 7 years ago, people were frequently waiting 15 weeks to begin their radiation treatment, and well over 200 women were sent in between 2007 2008 to Australia for their breast cancer radiation treatment. So we put a big effort into that part of the cancer journey, and no one now waits more than 4 weeks for that. That's just been a fantastic big change. What we're going to be talking about in the next month is how we actually speed that up further, because that's only measuring part of the cancer journey. We actually think that we should be measuring it from when people first go and see their GP and putting much more rigorous timelines in so that we can guarantee much faster treatment for people.
Mr. Minister, we've heard some rather appalling figures for Maori and Pacific Island cancer patients, and certainly of prostate cancer. Could you indicate what type of particular emphasis is being placed in the various programs
Yep.
on addressing these particular groups?
Yep. Well, I think there's certainly a role to play there in individuals' awareness, but here is the conundrum when it comes to Maori, and it's actually going to surprise you. So for many years we've lived under this apprehension that Maori people don't go to the doctor, and they always present late. And there may be an element of this lateness of presentation. But actually all the evidence we have is that Maori go to the doctors as much as anybody else in the community. So their presentation rates are exactly the same. In fact, in some parts of the country, they're slightly higher. So it's not so much a question of people not going to their GPs, it's more of what actually happens when they get into the system and when exactly they have these conversations. So from the government's point of view, we think that every New Zealander should expect the same standard of healthcare regardless of where they come from. The way of fixing this, of course, is just raising awareness of the fact that these conversations need to be had across all communities in New Zealand, and that's a responsibility we expect the clinical community to have, and also the rest of the community to make sure that the awareness is there for people to do that. Great, well thank you very much.
Thank you, Mark. It's going to just come and the vote of thanks.
Thank you, Minister, for giving up your Sunday morning, and apologies to your wife. I was sitting there reflecting that while I might on a Sunday morning have gone to be part of a theological meeting, in some way this meeting probably can expect to see rather more concrete results as a result of meeting than perhaps a theological meeting. Which is
Actually, my wife wanted to come because my parents are staying with us at the moment. She was really tempted.
Well, tell her she'd be most welcome to come this afternoon. You can look after your parents. It is really important that we have dialogue with politicians. And I don't mean that in a political context, but I was sitting there and just thinking, in some small measure, and perhaps some would say in large measure, the shift that has occurred in the last 10, 15 years in New Zealand in prostate cancer, and the fact that the Minister can take some satisfaction when he goes around and talks to his fellow ministers around the world, that we may be leading the world in terms of the way we're addressing prostate cancer. To some degree at least, the Foundation can count itself, can put a tick in the box in terms of not just increasing public awareness, but also getting the attention of the politicians. But having said that, I also want to say that I think it's very important that in this area, we had a select committee report that was unanimous. Excuse my cynicism, but getting a number of politicians from different parties to all agree on anything is a remarkable achievement. And in this area, which is controversial, I think it's particularly remarkable. And I mentioned Paul Hutchison earlier, and I want to pay tribute to him for his skill in chairing that committee, but also in convincing then the government to adopt the recommendations of the committee. So I think it's hugely important. And Minister, if you leave office with no other success story that you can think of, then certainly this is one which we, at least in this room, who've been affected by prostate cancer or are involved in providing prostate cancer care, we're immensely grateful for your advocacy on behalf of those who suffer prostate cancer. So thank you very much.
And it's really good to be here because I know 54% of New Zealand are hoping for a blue September as well.